Practicing medicine without insurance is possible. Imagine a private practice where you get to see your best patients every day, providing medical services you truly enjoy, all without the hassle of insurance. My name is Dr. T. Nguyen, and I'm a recovering specialist who was completely burned out from insurance-based medicine. I pivoted into direct care, where patients pay me directly for my medical services and have never looked back. If you're a private practice owner or planning to become one who's looking to be free of the grind of insurance and you're craving simplicity, efficiency, and connection with patients, you are in the right place. This podcast will help you map out your exit plan and uncover the mindset needed to thrive in today's economy. Welcome to the Direct Care Podcast for Specialists. I have Dr. Becky Mullin here. She is a podiatrist who has started her direct care practice, and I just want to welcome you to the show.
Thank you so much. I'm happy to be here.
We all want to know, what made you decide to choose direct care? I mean, take us back to where you were. What broke the camel's back? And what does life look like for you right now?
I heard a T win, so that's probably where it started. But no, all jokes aside, though, I worked in a multi-specialty group for almost 10 years, and it was great. I had a good employer. I enjoyed my job. I just got really tired of seeing 25 people in a day, and I didn't want to continue doing that model. And I had I have way too many kids. And so, I love them, but there's just far too many of them. And so trying to do the whole momming aspect, but also trying to be a physician at the same time was really hard to balance. And so, I went part-time at my job, which helped, but it still didn't help. Because one kid would get sick or something like that. And my husband and I would look at each other and be like, okay, who's staying home today? And it was never me, because you can't reschedule 25 people, 30 people in a day. Mm-hmm. So it always fell back on him. And we just kind of got sick of that. And one day I was working with the partner that I was with at the same time. And I said, you know what? I just want to open up an ingrown toenail shop in a strip mall and take out ingrown toenails all day long for cash. And she goes, there's a podiatrist that does that, T Win. And I said, I don't know who you're talking about. And she says she's out in California and she does that. And that's where I looked at your website for the first time. And I was like, seriously, somebody is actually doing this? And so that's kind of where the seed was planted. And then I just started looking more into direct care and how primary care does it. And I was like, this makes total sense. Why don't more physicians do this? And so it was probably, I'd say, over the course of 3 to 4 years where I thought, I want to pivot to that direction. And then finally, about a year before I actually did move that direction, I said, okay, I am doing that. But then I took a year to kind of figure out the logistics of how am I going to make the jump and the leap. And so that's kind of the track that I fell down. And it has been great for us. It's worked so much better than what I used to have to do. So it's just a more pleasant way to practice for me. So that's kind of the path of how I ended up this direction, at least. So
you fell down the rabbit hole. Welcome.
Yes, I did. I'm happy to be in the hole here. It's a much better hole to be in. So
did you say it took you about 3 to 4 years to make a decision?
It was more just thinking about it. Because you read about a lot of people that do it in primary care where, okay, yeah, they have patients and they have membership sort of stuff. But would anybody actually want to just pay me a fee one time to see them? Is kind of a different model than what a lot of primary care does. So there's a lot more fear, I think, that goes into it versus if you've been in primary care for 10, 20 years and you have a whole bunch of patients that are built up that they're more likely they're just going to follow you. And so you have the income going with you. So I think as a fee for service, it was more scary to do that. But as somebody that personally has an $8,000 deductible, I know I'll never meet it. So you kind of start to look at the insurance model and how much patients are having to pay to have their ingrown toenail removed. And it's atrocious.
Mhm.
And so I knew that I had a service that I could still provide, one, better care, and two, probably cheaper than the insurance model probably could provide for them. So I was like, well, why wouldn't a patient want to do that? So I think after a certain amount of time of convincing myself that, hey, insurance deductibles are terrible now, people are going to want to do that. Um, it's okay to jump and just do fee for service. That, yeah, it did take me a long time to, in my own mind, think that I could make it this way. So it took some convincing of myself, but eventually I just did because I got too tired of doing what I was doing. And so I was like, we're just going to take the leap because it's not sustainable doing what I was doing. I'm either going to leave medicine and fold towels at the gym, or I'm going to practice medicine on my own terms. So I just took a leap of faith and decided to do it. And it's worked out. So,
It's not uncommon where doctors are like, I'm just going to sell stuff on Etsy. I'm just going to, remodel or redo some furniture, upsell it. Like we're all trying to find an exit. And I
right.
think
Something
most
else.
of us, yeah, something else. Like most of us love medicine. We just don't like the system that it's in.
Right.
And so what helped you convince yourself to finally just say, let's just do this?
I mean, I think it's really terrible to say, but I have a running list on my phone of other career choices that would have been better than medicine. And every week I would add to it. I mean, it's like
Wow.
goldsmith, lifetime gym worker, greenhouse keeper, zookeeper, BNSF railroad keeper. And I was like, I have spent so much time learning how to be a physician that why would I abandon that because the system that I'm working in isn't working for me? And I hate to like toot my own horn, but I feel like I'm a pretty good doctor and I have so much information to tell people and I just couldn't tell them or treat them the way that I wanted to in that system. So I'm just like, if I want to do this and continue to practice how I want to practice, which is actually talking to people, sometimes for over an hour, I just sit and talk to them because I have other things to tell them, that I couldn't keep doing it in that model. So I'm either going to end up pivoting and doing direct care and doing it as I want to do it, or I'm just going to have to quit medicine because it's not sustainable that way. I mean, I didn't have the autonomy necessarily when you're an employed physician either of saying, when you want to work, how you want to work, what days you want to work, and what days you want to go on vacation, or I need to leave early this day, or I need to take my kids to a dentist appointment. And maybe I would have had some of those things had I gone into private practice too. But then it's still the rat race of trying to deal with insurance companies where it's not necessarily value based care, it's more volume based. And
Mhm.
so I'm just like, forget it. I will either leave medicine or I'll do this instead. And so I pivoted and we're going to see if it works out. And so far it has. So,
So tell us, when did you open and what did you plan for? How did you plan opening day, I guess?
oh man, how did I plan it? Well, I mean, I office in currently in a space where it's me and another internal medicine provider. And we were actually both employed at the same multi-specialty group that we were at for years before. Um, and she put up her notice that said, she's going to start and open up her own direct care practice. And we wish her nothing but the best. And I was like, oh, I said, that's phenomenal. And so I sent her a text and I said, Sally, that's exactly what I want to do someday when I grow up. And I said, it's going to be great. You're going to be successful. And she said, it was so pleasant to hear from me that I wished her well and told her it was going to be great because she had other colleagues that are like, that's a terrible idea. You've lost your mind. Why are you doing
Mhm.
that? And I said, no, it's going to be great. And she responded back, thank you so much. And, if someday is ever someday where you want to do direct care, she said, the place that I rented has too many rooms. So come on over. Um, and that was maybe about 3, 4 years before I decided to pivot. And she had been doing it for a year or two or something like that. And I sent her another text and I said, I still have to come and see your new office. I hope things are going well. And she said, I'm direct care. I'm here and I'm not doing anything. Come on over. And so I did. And I'm just like, this is phenomenal. And the office space was great. She was like reinvigorated with what she did, and her staff was there, and everyone was just happy. And it's more like a healing environment when you walk in there, as opposed to when you walk in the traditional and insurance-based office. It's more just, well, it's me and 30 other people, and here's my name and date of birth, where people actually knew each other there. And so I'm just like, this is just a lovely place to be. And she said, well, if you ever want to do it, you can do it. I mean, you could rent office space here or whatever. And I said, I'm going to do it. I said, I just need at least a year to figure out what I'm going to do and how I'm going to put my ducks in a row, and getting everything from malpractice to supplies to forms and all that stuff. So I said, I just needed time to figure out all the logistic stuff that you don't actually have to think about if you're an employed physician. It's much more work and it's much more taxing to get going, I think. So it took me a while to plan it, and it should be planned, but I knew that that's what I was going to do. And I told myself, when you tell her 1 year, you mean 1 year. And she's not holding me to anything by any means, but I was just like, okay, that's what I'm going to do. So I opened, I quit my previous job in January of this year of 2025. And I had pretty much most of my ducks in a row. I really just had to opt out of Medicare, which, I mean, takes like a month or something like that. So it was about 3-4 weeks before I was seeing patients again in this model, because I had put everything kind of together of what I wanted to do and where and how. But it took about 3 years to wrap my head around it, and about another year to plan it.
How did your former employee take your resignation?
I think they were surprised. And like I said, I worked for a good employer, and they were good to me. But there's still not the autonomy that I wanted. And so I think they were surprised, but they didn't like, oh, please, no, don't leave, or don't stay, or do whatever we need to do to keep you here, sort of thing. They were just kind of like, that's okay. And I had another partner that I was the one that told me about you initially, but I had told her prior to me resigning that I was going to do that. And she's like, oh, I'm so excited for you. So it was good to have somebody that was, supportive in that aspect. But my former employer they didn't necessarily care much. I think it bothered me more than it bothered them.
Oh, yeah. Because sometimes they just treat you as replaceable bodies. I don't know. That's my impression. Sometimes it's like, oh, that's sad. And then they're ready to hire the next doc in line, you know?
Best wishes. Yeah. No, I mean, and I sound like I'm on my high horse, but I'm not replaceable, because a lot of people would be like, I'm coming to still see you over here.
Yeah.
And so they still followed me, which I'm very impressed, and that's great. And I'm glad, and I'm still happy to take care of them. But a lot of like what you have done on your podcast is, don't devalue yourself as a physician, which has really rang true with me. And it's like, no, I do have something to offer people. And if they want to drink the coffee over at my coffee shop, they can. If they want to go to their insurance-based coffee shop, that's fine too. But I think it tastes like rehab coffee. So, but that's fine. If that's what you want. So,
right. It's kind of like airplane coffee. That's been sitting around for a while.
right, exactly. It's stale, and it was brewed last night on the red eye, and we're still using that this morning. Yes.
And it's okay. It's still functional. It has its purpose.
Right. If you want just the caffeine, that's fine. Tastes terrible, but you can do that. That's okay.
How did you inform your patients you were leaving? What was the process like?
So a lot of my patients, like if they were coming to have nail care or something like that, I mean, oftentimes they would book out 3 months in advance, because that's how far out those appointments went. And I didn't try to poach them necessarily at all. I would just say, when you come back, I'm not going to be here. I said, I do have a partner that's still here, and you're more than welcome to make an appointment to see them. I said, but I'm not going to be working here anymore, or if they were supposed to come back because they had a fracture or something like that. And so I always steered them towards, yes, you could certainly see my partner. She will still be here and provide good care for you. And then they would usually follow up with, what are you doing? Where are you going? And I was just straight. And I said, I was opening up my own direct care office. I said, I'm just tired of seeing insurance-based things. And so that's what I'm going to do. And they were like, well, can we make an appointment? And I said, it's a free country. You can make your appointment with whoever you want, when you want to. I don't care what you do. They're like, well, how do I get in touch? And I was like, I don't even know. I don't even have a business name yet. It's like, you'll just have to like Google me, I suppose. I don't even know what I'm doing yet. So that was kind of how I would let patients know if they were coming back. But I mean, if they weren't coming back, I wasn't be like, oh yeah, by the way, if you ever have another foot issue, I'll be over here. Because I'm pretty goodwill, and they didn't necessarily, I don't think, had anything in my contract, but I just think that's what you should do.
Right.
So I played nice.
Yeah, that's kind of my impression is like we obviously don't want to make people upset, like we just got to do our own thing. And you're right. People can choose it. It's a wonderful country. It's a free will country,
Yeah,
People
right.
can choose. But I know that a lot of doctors who are listening have a bit of fear, kind of like a scarcity mindset, like I don't know where the patients are going to come from. How do I fill up my schedule? And I imagine you had some of those concerns in the beginning. So, how did you navigate that in trying to make sure that you stay financially viable?
This is terrible advice because I stopped caring. Because like I said, I was either going to keep doing what I was doing and be burnt out, and I'd go fold towels at the gym for $15 an hour, or I would do this and maybe make some money. But I mean, I'm blessed that I'm married to someone that could financially support us too. So it was easy for me because I didn't necessarily have to worry about it. It was more just like, well, let's just do this and see what happens. But it's been great. Do I make the exact same amount of money? Pretty close, but I work a whole lot less and not very hard.
That's amazing. And you
So
said you started earlier this year, then, right? Your
I
practice?
started only in, yes, February is when I saw my first patient.
Amazing. So tell
So
us about like your overhead expenses.
I should do my profit and loss statement more frequently. But my husband is in charge of all those things because he does finance. But I mean, I just had to buy all the initial stuff upright, like everything from your exam chair to all of your equipment to your x-ray machine, things like that. Then obviously there was my rent that goes with it, my malpractice. And that was the most expensive things that were out there. And then there's just little tiny piddly stuff from your EHR to, oh, by the way, I got to get an autoclave and I got to buy it. They just kind of tumbled right on top of each other as far as the expenses go. And then it's like, well, how do you make money, or what do you even charge? Which
Mm.
it's really just testing the market. And I've already increased my prices once. I probably should do it again today because it was sometimes pretty exhausting talking to people for what I felt was not the right amount of money. But I did enjoy it though too.
Managing a direct care practice to be financially viable is a huge concern for doctors who've had a paycheck every 2 weeks, right?
Right.
And so, what's happening for you right now where you're like, I'm okay. Like, I'm okay with the circumstances. What's your mindset around that? What would you advise the doctor who wants to do direct care, who's really concerned about their financials?
Sure, that it's terrifying.
Hmm.
And especially as a fee for service physician, I think it's really scary. Um, but I listened to like a lot of your podcasts and it's like, well, what do patients value? And they really value your time as a physician, and what services do you offer that patients aren't going to get in the traditional insurance model? Which is a lot of couple things to focus on, I think. Um, so I think as a fee for service physician, it was a lot harder than it is is a primary care one. But I've also, like I said, came to realize how much patients are paying for healthcare and not getting any care when you have an $8,000 deductible. So you can beat the insurance game, especially if you can be competitive in your pricing, but also you're providing it in a happier environment for them that they will come. I mean, a lot of people say that this is just for people that are rich. I'm just be like, I have patients that come in every day that have no insurance. And people's like, well, everyone has to have insurance. No, there's a lot of people that don't have insurance. And so they will specifically seek me out. Or I'll have a lot of patients, they too have an $8,000 deductible. And it's like, well, I'll never meet it. So I might as well use this instead because it's cheaper for them than utilizing their insurance. But sure, I have, NHL hockey players that also come to see me. So I have everyone across the board from being uninsured to insured with poor deductibles to really rich people. So I wouldn't be so fearful of who's going to come to see me because you see everyone across the board, that it's not just rich or it's not just unemployed, or people will still seek you out.
Do you market your practice, or is this purely word of mouth at this time?
So I ran like some Google ads, but a lot of the times there's other direct care providers, not a ton by any means, and I'm in Minneapolis. There's not a ton of them by any means, but I have sent letters to people and just say, hey, if you need anyone that you have patients that they want to get in and they have a foot issue, know that this is the same exact model. And so if they want to stick with that model, know that they can still come see me. So I've sent out some marketing that way, which is just the cost of a stamp and my time, for which some people have sent me referrals that way. But a lot of people, they just Google and they just find a podiatrist and then I come up. And I would probably say 2 out of 10 phone calls I get, people actually haven't read the website and don't realize that I don't take insurance, and that's okay. And just say, you can use your insurance and go elsewhere, and that's okay. But the rest of them usually just make an appointment. And so it's a combination of Google and some asking for referrals. I also am very, very good about, if patients come in, I ask them who their primary care doctor is, and if they want me to send their record from my visit to their primary care doctor. And if they say yes, that's free marketing, I think. And so I will automatically send back their note to their primary care doctor. And sometimes these primary care doctors, I feel so bad for them. They never get any information ever from a specialist. And so they're just like thrilled to get this information. And they continue to send their patients to me because I will still send them records if their patient allows me to do so. So I think that's a good way to get your marketing out there too.
That's amazing. I think your perspective is earnest and honest, because a lot of doctors, even in their direct care practice that I've talked to, that I've coached, they still kind of deal with the phone calls. Do you take my insurance? And some will say a lot of them hang up on them. And you're having a different experience. So I'm wondering, what guidance do you have for the doctor who's struggling answering that phone call? Do you take my insurance, where they feel like it's a rejection when the patient hangs up as soon as you say no? How do you navigate that?
I stopped carrying tea.
I just knew it. I knew you were going to say that.
Really
Your
is.
philosophy, I think, is going to help a lot of doctors, though,
Yeah,
honestly.
I have something that if patients want to have an experience that's done my way, they can come. And if they don't want to, I really don't care. That's okay. You can go and utilize your insurance. And maybe you had your appendix taken out this year, so you met your deductible and you want to use your insurance. I totally get it. Healthcare is expensive. So I feel like everyone just needs to make a choice for what is best for them. And it's the same thing when I take care of my patients. I'll say, yeah, you can do option A, B, C, or D to treat your plantar fasciitis. I think A works and B works. C is okay if you want to do D. It may not work real great, but if you want to try it, I'm okay with that. So I think all of it is about giving patients an option, and they can just pick what works best for them. So I really don't get hurt. I don't take time out of my day to try to convert them to a direct care one. And sometimes they're so blown off guard by the fact that I just answer the phone when they call that they're like, wait a minute, did I call the wrong number? And it's like, no, this is just what you get. You just get to talk to a doctor here, but I don't take your insurance. So sometimes there's like, okay, I'm going to call, some of my insurance options and say, okay, that's all right. Have a good day. And so some of those people have come back, but some not. And that's okay. I'm not for everyone, but if you want this experience, I'm happy to provide it. So that would be my advice is don't care.
I like that a lot. I'm going to run with that. What has surprised you in building or launching your direct care practice now that you have it?
I guess, like just starting off, kind of how much mental work it took to try to think about all the aspects of practicing that I didn't have to think about before. That it took more mental strain than I would have thought. I mean, it's just little itty bitty things. It's like, okay, well, how much do I charge for this, or how much do I charge for that? That I didn't. Then you got to factor in all the costs that go with it and your time, and it's like, how do I price that? I'm not really sure. So pricing is just one thing as far as, that was kind of surprising how much mentally it would take me to do that.
Did you use any resources to help you besides the podcast, of course?
I mean, not really. I guess I kind of take like what insurance was reimbursing sort of stuff and then beat that obviously, but still made it so that it's not discounted either, because I didn't want everybody and their grandma to make an appointment because I cost $20. That's not fair either. So I used some of that resource, but the podcast for sure was super helpful. But I followed a lot of, providers that are like on Instagram or social media and said, okay, well, this person does direct care, that person does direct care. How do they do it? How do they do it? So I guess that's where a lot of my ideas came from. And that was part of the whole planning process, that it took me a year to figure out, okay, they're making it work. How are they doing it? So a lot of, internet stalking, I guess, of other providers that are doing it and how is it working for them? So yeah, that just takes time and mental wear to try to figure out how to put everything into play for myself.
I think we'll have that mental strain indefinitely as a business owner because, we treat people, they get better. We got to get more people in.
Right.
It's, we need a machine to make this work. And it sounds like you've developed your machine through your relationships with other direct care practices. What do you advise the doctor who's like on the fence right now and they're like, I don't know, it sounds great. What would be their next, let's say, 3 steps to decide and commit to having a direct care practice?
Don't jump right away just because he and I are doing it. But really, you have to, it depends on, I think, a lot of what your specialty is too, and figure out, okay, what do I have to offer that is not offered right now in the traditional insurance model? And how can I offer it better? And so I think thinking about a lot of those things first before you would ever consider jumping would be one thing. But then just all the basic financial part of it, how much is a malpractice going to cost you? How much is an EHR going to cost you? How much is a rent going to cost you? And trying to figure out some of those things first before you would ever consider jumping or putting in a resignation. But then I probably would wait until you have a lot of that figured out and everything put together so that literally you can just go from seeing patients, opt out of Medicare and see patients in a month is ideal. So you kind of have to have all of those things put together, I think, before you would consider jumping. But I was like at the breaking point where I just couldn't keep doing what I wasn't doing in insurance. I was just exhausted at the end of the day that I just couldn't keep doing that. So like I said, I was either going to quit doing medicine or try this and see if it worked. And if it worked, great. If not, the gym was still open. I could still fold towels there. So For me, it was at a breaking point where you just come to realization, I can't do this anymore. And if there's another viable way, I'm going to do that instead.
One last question for you before I let you go. Can you complete the sentence? Direct care has done blank for me or my life.
Direct care has given me the autonomy that I never previously had in my medicine life. Because like I said, I had a great employer. I had great colleagues. And they weren't all up on me all the time and telling me how that I could practice, but there certainly are still restraints in the insurance-based model. One, on quantity of people that you have to see and how much you produce in your work RVUs. So it was good in terms of that I didn't have a lot of oversight from them, but it would be, you get this many vacation days a year, or you took off early because you needed to have an eye exam done. We'll take, 0.028 hours from your vacation time. It's like, but now I have the autonomy to say, you know what, I'm not going to work that day, or I am going to work that day. And I just block my schedule, or, hey, my kids have a school event that I'm going to do instead. So it helps give me the autonomy that I need in the spot I am in my life right now. So direct care has been good for me for autonomy, is probably the word that I would choose to fill in that sentence.
That's perfect. If doctors want to find you, how can they connect with you?
My website is mullinpodiatry.com, Mullin. And I'm based out of Minneapolis. So they could find me there, or my email. We can put it in the show notes below too, if you want to.
Perfect. I appreciate your time so much. I'm so excited for you. And your
Thank you.
anniversary is just around the corner.
Coming
Really,
up
if you think
hot.
about
That's
it.
true.
Yeah.
Oh,
We're in Q4, Q1. I hope you
I
have a
know.
nice celebration of your autonomy. And I really appreciate you being here and for listening in.
Perfect. Thanks, Dee.
One last thing. If you took anything from this episode, whether it's a small dose of inspiration or even an aha moment, could you please share it with a friend or post it on LinkedIn? The direct care community depends on doctors like you because no one is coming to save us. So it's up to each and every one of us to keep the conversation going to a point where direct care becomes a normalized path for private practice and not some secret that we have to mine for. Thank you if you've already done so, or if you've given this podcast a review. It really does mean a lot to me. Sending you peace and possibilities. I'll catch you next week. Take care.